Now on Face the State, Governor Lamont issues sweeping reforms in the wake of the death of George Floyd and the demand for racial equality and improvements in policing. Is racism a health emergency? We'll ask State Senator and Dr. Saud Anwar. Plus, what else needs to be done to improve race relations? We'll talk with author, broadcaster, and former Major League Baseball player Doug Glanville. And Christopher Columbus, his statues are coming down. But was he really as bad as people say he was? We'll ask Quinnipiac University history professor Phil Gaduti. It's all straight ahead this Sunday, June 21st, Father's Day 2020.
From Eyewitness News, Connecticut's most watched local political program, this is Face the State.
Good morning, everyone. It's 8:30. Welcome to Face the State on this Father's Day. I'm Dennis House. We begin today with the very latest on race relations in Connecticut and the coronavirus. Our first guest is State Senator Saud Anwar, who is also a physician. Dr. and Senator Anwar, thanks for being with us here today.
Thank you so much for having me, Dennis.
You have argued that racism should be declared a public health emergency. Why?
Well, Dennis, when we have systemic, structural, and institutional racism, that has a deep impact on the health of our citizens. We know from the data for the state of Connecticut, and Connecticut Health Foundation has looked at this data, the citizens of the state of Connecticut are actually paying just from the hospital cost every year about approximately $500 million more than they would just because of the health issues that are directly impacting the African American, Hispanic community, and the Asian communities and others as well, just because of the structural institutional racism that they're seeing.
What kind of illnesses and ailments do you see from this?
It's a whole spectrum. What we know for a fact is asthma is 5.5 times more emergency room visits for the African American children. Hispanic children have 4.5 times more likelihood of going to the emergency room with asthma. Prostate cancers are twice as likely to cause death in African Americans. In the same way, we can see hypertension, cardiac diseases much more prevalent in the African American community. And actually, this whole thing was magnified really very clearly during this COVID pandemic, where we saw the disease being much more significant spread within the minority and African American and Hispanic communities. And also the severity of the disease was much more in the cases as well. The death rates were higher. That really magnified what we have always been seeing. I'll just add a couple of other things. Diabetes is twice as likely to kill African Americans, and amputations are 4 times more likely from diabetes in African Americans in our state.
What is the resistance to declaring racism a public health emergency?
I think everybody is recognizing that we have a responsibility to do something about this, and I don't feel that there's a resistance. It's just highlighting what it would mean. And I think that's where first we have to recognize that there's a problem. Once we recognize that, we have to have a strategy to address the immediate needs and the impact of it, and then move on to the next level to have a comprehensive strategy to prevent these diseases from happening. For community members who are impacted by racism, our African American brothers and sisters and our Hispanic brothers and sisters, they actually have to live with a high cortisol level, and because of their stress at every aspect, every turn of life, and in living their life. And that results in changes in the body, which causes the blood pressure to be high, their resistance much lower. And these things have a long-term impact on their well-being, and mental and physical, and seeing all of those in our data as well.
As a physician, I want to ask you this question. We know that in the case of George Floyd, he was kneeled on. That led to his death. What other kind of police procedures, in your judgment, are dangerous for a person who's being apprehended?
Again, look, anytime anybody's having a chokehold, irrespective of their race, irrespective of the background, this is not healthy for individuals. We have people who have poor lung condition and poor heart conditions. Anytime there's going to be a stress on their body, they would have some difficulties. Again, people are using tear gas and pepper sprays. They actually, individuals with respiratory problems, are going to cause some trouble for their breathing going forward. If you look at the tear gas that at times has been used in some of the riots and so on, these things have been banned by the Geneva Convention in war situation, but we use it in our communities, in our societies. So again, physical direct impact on the well-being, respiratory status, cardiac status. Those are the things that would harm individuals. And we just have to be cognizant that we are trying to create the law and order control, but we are not in the process of harming them physically and, God forbid, and can lead to death of individuals.
Senator, I want to shift to the discussion about police reform. What kind of reforms do you think Connecticut needs?
First, I want to thank the governor for taking the lead in that aspect. I think what I would say is that my friends who are my African-American legislators, they are actually coming up with a very comprehensive strategy. I know Senator Field is a leader, not only in our state, but in the country, who's actually putting a whole package of reforms. So I would look to him for his expertise on some of these areas. But the most basic things that are required are going to be to recognize that some of our actions and some of our training, some of the recruitment aspects, they will have to be started from scratch to see we have diversity within the police force. We need to ensure that there is accountability for every action. We also need to make sure that individuals are treating each citizen equally. And there needs to be training of people to make sure that they are doing this and having accountability at all levels with transparency for actions that they do with recording devices that would be accessible to the victims, but also the police as well. So these are some of the very basic things, but there's going to be a comprehensive strategy. But I'll just add one more thing. This is one part to the whole picture. There's so much more that needs to be done, which I call this the police brutality is a symptom of a broad issue, and we have to address those as well.
Let's shift to coronavirus for a little bit here. What is your concern as we are now in phase 2? We're now looking ahead to phase 3. The summer's here. People are out. They're in restaurants. They're in gyms. What is your biggest concern?
We have done very well, thankfully, in our state of Connecticut. When we look at the rest of the country and many of the states, we have done very well, and kudos to the governor and his leadership. I am worried about people following the recommendations, and as a result, the community spread resurgence can happen. And those are the things that I worry about. And I know that many of the businesses may not be as obsessive about it. And I think if we can make sure that they're obsessive about cleanliness, about the people coming into their facility, having the protection, masks, and the distancing would be very important, because there is a risk of resurgence, and this happens in other parts of the world. So it's likely can happen over here, and that's why we have to follow through on each and every recommendation.
Dr. and Senator Saud Anwar, we thank you so much for being with us on this Sunday. Stay safe out there.
Thank you so much for having me. Thank you.
Thank you. In a moment, you know him from TV and sports. Today, he's talking racism. Doug Glanville is with us next. And we welcome you to watch past interviews of Face the State on our YouTube channel or on the WFSB streaming news app.